This is my audience, 8 people. And here we go. This is my speech on reducing single-use plastics in our hospital. Hello, and thank you, members of the board, for being here tonight. Every single day in hospitals like ours, we throw away huge amounts of plastic. From gloves, gowns, syringes, packaging, and even tools that are used only once before being disposed of immediately. All of that plastic doesn't just disappear. It ends up in incinerators and landfills and sits in there for centuries. It can even leak into waterways and harm the environment we're supposed to be protecting. As healthcare professionals and leaders, we take pride in our patients' health. But part of caring for people also means caring for the world that they live in. I see firsthand how much plastic we waste in this hospital every shift. So today, I want to persuade the board to take action by updating our hospital's policies to reduce single-use plastics whenever it's safe and possible to do so. My goal is simple: shift towards reusable or biodegradable alternatives to improve environmental health, save money over time, and strengthen our hospital's reputation as a leader in sustainability. In this speech, first I'll explain the environmental and health impact of plastics. I'll show how reducing plastic waste and reducing single-use plastics in our hospital saves money in the long run. And finally, I'll present specific policy changes we can implement as soon as tomorrow. Plastic waste harms environmental and public health. Right now, hospitals contribute to a significant portion of the world's plastic waste. According to an article from the journal Curious, published in 2024, the use of disposable plastics has, quote, soared in healthcare, including tons of waste from gowns, masks, and medical packaging. This waste is a major contributor to microplastic pollution and harmful chemical releases into our environment. Another study published in Scientific Reports 2024 explains that when single-use plastics are landfilled or burned, they release pollutants that can impact human health beyond the hospital walls. So while plastic helps maintain sterility and safety, the long-term environmental damage causes serious new health risks to the public. So the very tools we rely on to protect patient health are, in the long run, contributing to the decline of environmental and community health. And if protecting the environment isn't reason enough, reducing plastic waste also makes financial sense. Reducing single-use plastic can save the hospital money. Research shows that reusable options cost less in the long term than single-use options. A study in the Journal of Hospital Infection in 2022 found that surgical departments that switched from single-use items to reusable or hybrid instruments significantly lowered both their carbon footprint and their financial spending. Also, the AMA Journal of Ethics from October 2022 explains that hospitals who adopt better waste sorting and reuse programs save thousands of dollars per year, both purchasing supplies and in waste disposal. Instead of paying constantly for new disposable tools and then paying again to throw them away, we can invest once in reusable equipment and save money year after year in our hospital. So now that we know it's both better for the environment and better financially for our hospital, let's talk about what we can do to actually change these policies. Here are some realistic changes our hospital board can support. Number 1, require departments to use reusable or biodegradable options whenever it's possible and safe to do so. That includes reusable gowns, drapes, trays, or metal and hybrid instruments. According to the AMA Journal of Ethics in 2022, these products are already proven safe in hospitals across the country today. Number 2, provide staff education and training on proper sterilization and waste sorting procedures. A governmental-backed report in the journal Healthcare, published in 2022, shows that waste reduction efforts succeed when the staff receive the correct support and instructions and advice on how to do it. Number 3, Partner with suppliers offering eco-friendly packaging and reusable systems. Many major healthcare suppliers now offer biodegradable options that are already safe to use in the healthcare industry. These are not radical changes. They are professional, responsible, and already being implemented successfully in other medical facilities across the globe. So let me close with this. Reducing single-use plastic in our hospitals is not just a good idea. It is the next step we must take to make our hospital a leader in sustainability and healthcare. Today, we look at how plastic waste harms public health and our environment, how reusable alternatives save significant money, and how simple policy changes can make our hospital a leader in sustainability. I am urging this board to adopt new policies that reduce single-use plastic, invest in reusable medical tools and biodegradable alternatives, and support staff education to make this change possible. By doing this, we protect our patients today, and we protect the world they live in tomorrow. Let's take action now and lead by example. Let's take the next step in healthcare. Thank you. This is my audience again.